Hello my friends, in this video I'm going to propose an evidence-based astrology pyramid. Different fields have an evidence-based pyramid. For example, there's an evidence-based medicine pyramid. And what I'm going to do here is suggest a pyramid that would work for astrology, to introduce an evidence-based astrology pyramid. Now, what is an evidence-based pyramid? It's a key part of an evidence-based practice, because an evidence-based practice is much more than simply finding evidence. Like you might think, oh, an evidence-based practice, well, isn't everything evidence-based? People look for evidence for what they're doing. No, there's much more to it than that. There are guidelines, regulations, rules. There are parameters for how things work, in an evidence-based practice. So as I have here on this paragraph on this slide, there are also clear regulations and guidelines for what evidence gives greater confidence. So in an evidence-based practice, the experts in the field evaluate different forms of evidence, and they assign different levels of confidence depending on what that evidence is. And that's what the pyramid is all about. From the most general evidence that's not very specific, that gives very little confidence, all the way up to the peak of the pyramid for what gives the most confidence. So the evidence-based pyramid provides us a clear map of how we decide what has the greatest evidence. And these pyramids are well agreed upon within a discipline, and they really do provide a solid foundation. You do not end up with a situation where there's so much arguments going on about the nature of the pyramid that it just becomes a philosophical battleground. No. There are clear regulations that can be developed and that guide a discipline to become more effective, to provide better services, because there's better evidence. We're more sure that they really work, and they do work, and they improve the field. So every field has its own evidence-based pyramid. And now I'm going to show you one that's used in medicine first, and then I will show you one that I'm proposing for astrology, and it's one that's going to soon appear in the research guidelines provided by the Cosmobiology Institute. The Cosmobiology Institute is a research institute. The website is cosmobiology.org, and it provides resources, tools, guidance for conducting research in astrology. And this astrology pyramid will appear in the guidelines that will be published there very soon. Now, before we continue, just one thing before I show you this medical pyramid, evidence-based medicine pyramid, which is this. You could say there are two things involved. One is create the guidelines for what evidence-based practice is. Second thing is follow the guidelines. Like if you have speed limits in an area for people who are driving their cars, and those speed limits are not enforced and people drive any speed they want to, then the speed limits don't do anything. So you have to have regulations, and then you have to have a way of enforcing them. In some fields, the enforcing of those regulations has been more successful. In other fields, there have been problems enforcing them, getting people to abide by the regulations. So as an example of a flagrant violation of the regulations for an evidence-based practice, I have a quote on this slide, and I give the website address. I'll read sections of this. I put in yellow highlight the key parts as relevant to what I'm presenting here in this paper. But let me read from the beginning. The conference Psychotherapies for Anxiety and Depression, Benefits and Costs in Padua, Italy, in November 2016 has been important. And here's what's going on. So there's this conference in Italy. The situation of the treatment for anxiety and depressive disorders is somehow paradoxical. So this is a conference about treatment for anxiety and depression. And here's the paradox. Here's this contradiction. The empirical evidence on the efficacy of psychotherapy for common mental disorders such as anxiety and depression is well documented in the literature. The efficacy is often superior to medication. For example, to read from the highlighted section, effect sizes of general psychotherapy for various mental disorders range from 0.73 to 0.85. Effect sizes of antidepressant medications is much lower, 0.17 to 0.31. So here are studies that have been conducted, very well conducted studies, and they show that the effect size of using psychotherapy is greater than for antidepressant drugs. Effect size means how well it works. So therefore, according to the regulations of evidence-based practice, how should we treat disorders like anxiety and depression? With psychotherapy, because that's working better. That's the whole point of having an evidence-based practice, is to have regulations for what kinds of evidence give greater confidence, evaluate these studies that have been done, come to conclusions, and there you have it. What's happening in this case? All of that's been done, but it's not enforced. It's not implemented. So what's happening is, nevertheless, to read the next highlighted section, medication is the most common treatment for these disorders. Now here's the conclusion. Listen to this. Since evidence-based research is ignored, in other words, they're not using the therapy that has the greatest evidence, this can be considered a form of malpractice. Yes, it's a form of malpractice. And it would be unacceptable in the treatment of medical conditions. So in this case, certain kinds of treatments are allowed, but the professional organizations that regulate and oversee that profession, they should be enforcing these guidelines because these evidence-based practice guidelines work. It's been shown over and over again that the therapies, the practice that uses evidence-based methods works. However, in some fields, such as medicine, there's a lot of corruption, there's a lot of influence in ways that violate the principles of evidence-based practice. I just wanted to mention that because very often people will say, oh, you have evidence-based medicine, it doesn't really work. Well, let's think about why it doesn't work. Is it a problem with the regulations and principles of evidence-based practice, or is it a problem in them not being implemented? So the professional groups need to implement them. And there's no magic wand that there's no way to sprinkle fairy dust on people and make them honest and have integrity. So problems do occur, but you have to have the regulations and then implement them. So here is the evidence-based medicine pyramid. And the way these pyramids work is at the bottom is the most general information that tells us something about what medical applications, what medical treatments would work the best. And then you go up the pyramid with methods that give greater and greater confidence, greater and greater clarity, greater and greater assurance that the medical procedure is effective. So what we have in green at the base of this is background information and expert opinion. This is the lowest level of evidence. So you ask medical practitioners, doctors, healers, anybody who's involved in the field, what do you do? How do you treat illness? This is the expert opinion. It's the background information. It's the starting point. You have to start somewhere. So it's very important as a foundation, starting with the anecdotal evidence, starting with the experience of people in the field and what their expert opinion is. It's also the lowest level. It gives us almost no confidence at all. You can have 100 doctors, 100 astrologers, 100 psychics, 100 plumbers, 100 anything, all agree and say, this works. It still does not give very much confidence. What you need to do is have some kind of systematic study of that information to gain greater confidence. And that's the second tier. There are 3 tiers here. First tier is general information. Next tier is unfiltered information. These are the controlled research studies. These are the documented observations that other people can repeat, replicate, observe, analyze, see what you did. You should publish the data that was used. Make it transparent. This is the unfiltered information, the actual primary source data on something. And you'll see that for medicine there are 3 levels. The lowest level is case-controlled studies and case series and reports. And I've written this from the ground up at the bottom level here. I've explained what a case report is and a case series. So the case report and the case series, the lowest level of controlled research studies in medicine, is a detailed report of the diagnosis, treatment, response to treatment, and follow-up after treatment of an individual patient. And then there's a documented explanation, documentation on what happened with a client. I had a client came in, these are the symptoms, this was the blood test, this is the data, especially quantitative data, exactly what is the client, how tall, what is the weight, what is this, what is the gender, everything, what are the habits, what is the relevant information for what's being diagnosed, and documenting what happened. That's a step up from just saying, oh, this is what I do, and not documenting it clearly, not making it possible for other people to see exactly what you did, and to report fairly openly and honestly what's happening. And then a case series is more of that. Case series is a group of case reports involving patients who have been given similar treatment. So you start getting numerous people tracking it. That well-documented evidence of what happened is still the lowest level. The next level above that is cohort studies. This is a type of disease-related study in which a group of people with a common characteristic is followed over time. So here you follow the person over time to find out how many reach a certain health outcome. So here you're looking at the treatment of an illness or a disturbance, a disease of some kind, what treatment was given, how the people responded. So a cohort is defined as a group of persons, usually 100 or more in size, who share a common characteristic such as smokers. So it's a larger, more controlled observations of a group of people sharing a situation and a treatment and what happens. Now, a big step above that is a randomized control trial. It gives us tremendously more confidence. A study design that randomly assigns participants to an experimental group or a control group. As the study is conducted, the only expected difference between the control and experimental groups in a randomized control trial is the outcome variable being studied. So this is your top level. I'm not going to give examples and discuss this in even more detail. You have the idea. Different kinds of studies giving different levels of confidence. Then the next level of understanding in an evidence-based practice is the filtered information, the top part of the pyramid, the 3 top things. This is where you critically appraise the research. Somebody looks at the different research studies, evaluates and compares them. So you can have a critically appraised topic. This is a format for sharing information in an evidence-based practice. It's a standardized summary of research evidence organized around a clinical question. So a review of particular studies to evaluate how well they are. Above this, we have a systematic review where you analyze, describe, critically appraise, and summarize interpretations into a refined evidence-based conclusion. So A critically appraised individual article, somebody's assessing a given research study in a systematic, higher level, you're taking into account many, many studies, and in a systematic review, you extract and interpret data from published studies on the topic and fully analyze and compare all the research that's relevant to come up with conclusions for the practitioners. Now, here is my evidence-based astrology pyramid. Same idea, 3 levels. I have here at the bottom the green level. This is expert opinion. Then the blue level. These are your controlled studies. And then the top is where somebody compares and contrasts the different studies to reach final conclusions. So in astrology, the expert opinion comes from ideas that have been passed down. The ideas in the books and the literature and the articles and the lectures and the website information. The ideas passed down historically and people's personal experience and their expert opinion. Also, I made a separate item which is logically inferred from these principles that are handed down. So, for example, people have the idea that Mars is action and aggression, that Jupiter is big and expansive, that trines are easy. Therefore, trine is a certain angular distance between the planets, 120 degrees. So therefore, if Mars is trine Jupiter, you would do Mars, take action, big things, Jupiter, easily. So a lot of astrology is based on this logical assembling of the fundamental principles. These are all theoretical and based on personal experience. It's the source material for the primary evidence. The primary evidence, or what in the medical diagram was called the unfiltered information, that unfiltered information is another term for that is the primary evidence, the actual studies. And so I've got different levels of studies, from the ones that give less confidence to ones that give more confidence. But note this, even though we have strict hypothesis tests giving us more confidence than a case study, there are other things besides the research method. There is what the results are. What are the p-values or effect sizes? What was found? There's the elegance and simplicity of the set of predictor variables. There's the quality of the control group. There's how much measurement error. There are many, many things that affect how much confidence we derive from a study. So it's not as simple as saying a study at the top of the pyramid gives more confidence than one lower. It does, everything else equal. But it might be that the strict hypothesis test had some major flaws in the way it was conducted or limitations that decreases the confidence. Keep in mind that research is done in the real world with real world constraints, not in some perfect world where you have infinite resources. So some studies have a lot of weaknesses and they only give a little more confidence. That might be all that was possible. That's not necessarily a fault of the researchers. It may be the nature of the situation and what was possible. But any, even little step to gaining a little more confidence raises us up above this bottom level. So on the next slide, we're going to look at in more detail at these research methods used in astrology. These are just the ones that I'm proposing in this evidence-based astrology pyramid. This astrology pyramid can be refined and improved over time, but this is a start to having clear guidelines for what gives greater confidence and what gives lower confidence. And at the Cosmobiology Institute website, www.cosmobiology.org, there are research guidelines that go into great detail. Let me show that to you very quickly. Let me see if I've got my browser up here. Oh, no, I don't. Let me just drag this over for you, bring this up here, and let's go to cosmobiology.org. So there's the website for Cosmobiology Institute, and if you go to research, you will see the condensed version of the research guidelines. Goes into great detail on the different research methods, and soon we will be uploading the full guidelines, many, many pages. So each one of these research methods described in detail and what's involved in it, what are the limitations, what are the positives, and what are the strong points and weak points of each research method, when is it appropriate, what does it tell us, what does it not tell us, all of that will go in there. What we're looking at here is the overall perspective, and this will also be in the complete research guidelines, this overall understanding of how we determine confidence levels. Okay, let's look at some of the details. The starting point, of course, is, as I mentioned, whatever astrologers experience and believe works, that personal experience. Above that, we have case studies. A little bit better, bringing us out of just personal experience and tradition, are case studies. Now, case studies must be detailed, and they must have thorough documentation. A case study is not really just, oh, I consulted somebody this morning with an astrological consultation, and they had this aspect in their chart, and yes, sure enough, that was in their lives. That's, or just saying, anyway, that's not very good. Or just saying, well, I've done 20 consultations, and every time this worked. Where's the doc? Oh my, that's not a really good case study. A real case study involves detailed documentation, providing the birth data so other people can run that to show how did you make these observations. Was it through a conversation? What was that conversation? Hopefully you recorded it, and then you can go back to the recording and quote what actually was happening. Did you lead the people on? Was it open-ended? We have to examine carefully what exactly is going on and document very thoroughly. A real case study requires a lot of time and energy and documentation to make it very clear what's going on, to give even a little bit of confidence. So the loose kinds of things people often call case studies, which means they just consulted somebody and they didn't have ways of evaluating, measuring. They didn't have other people review and analyze what's going on. That's really not a case study. Okay, so it needs to be detailed and thoroughly documented with a lot of controls for how things are evaluated. Number 2, a little bit better than that, is qualitative model fitting. Here's where you have an experimental group and a control group. And you look at the data, like you might look at people that suffer from mental depression versus people that don't. Or what we call a shuffled control group, some kind of control group, to compare what's going on. And maybe you don't have a very good idea of what is in the charts of people with, who suffer from depression or something like that. You can do this on the predictor variable, the astrological variables. You can also do it on the outcome variable. You can say, what does Aries mean? What does Taurus mean? You can go through a database, select out the people who have the most Aries, read their biographies. This would be a qualitative study where there's not numbers, there's just reading the biographies and making an argument. Because you've removed selection bias, because you're not picking the people, because you're going through the biographies of the people. Hopefully there's more than one researcher overseeing, commenting on each other, and coming up with some kind of conclusions. This is model fitting. Gives us a little more confidence that if you look at the people who have the most Aries in their chart and there's no evidence that they're pioneering, there's no evidence that they're brave, there's no evidence that they're innovating, this gives us some confidence that those ideas about Aries are wrong. Even more than all of your personal experience. This is the power of modern research methods. And if it confirms that Aries has those qualities, then it gives more confidence that those ideas work. So these are techniques for different levels of confidence. But even a little bit of confidence is better than no confidence. We have moved up the ladder. We're up to here. We're up in the blue area of actual controlled studies. We're actually getting greater confidence than we are down here. So you do not need to do research with perfect control groups and perfect this and perfect that. You can climb the ladder little by little. And you can do these kinds of research that also build a foundation for the higher levels of research. Sometimes these kinds of studies, like qualitative exploratory research, clear the air. They give some greater idea of what exactly to spend more time and energy on a study that would give you even greater confidence. So the next level up from the qualitative model fitting is quantitative model fitting. Same thing, but here you can assign numbers. Here you could use things like, if you're studying astrological variables like aspects, or even zodiac signs, and you could give a numeric score. Like you get 10 points for Sun in Aries, 5 points for Moon in Aries. You can make a formula, and you can see who comes out strongest with that formula. You can have things that are clearly measured and identified, and the results are quantitative. And then above that is not just going into the research with vague ideas, but having clearer ideas of what you expect. So you go in and you look at people who have suffered from depression, and you say, oh, I expect them to have Moon in Capricorn or Moon square Saturn, and I think Moon square Saturn will be the greatest indicator, and I think the orb is like 4 to 5 degrees, and the smaller the orb, the stronger it is. So you're getting fairly clear expectations, but not perfectly clear. You're not absolutely sure, but you've got some fairly good ideas. This is a kind of model testing where you're refining and improving a model that you've built. You have some flexibility in the model. You're not being completely rigid, but you also have some strong ideas of what you expect. You're expecting Moon square Saturn in people who have depression. You're not sure exactly of the orb. You think it's stronger than Moon in Capricorn, but your research might adjust your thinking a little bit. This is model testing. Above that is a strict hypothesis test. This is where you have no flexibility. You say, Moon square Saturn inclines to depression, 4-degree orb. The smaller the orb, the stronger it is, and it's proportionally stronger. And I'm going to give that 20 points if it's exact. And Moon in Capricorn, I'm going to give 3 points because it's not as important, etc., etc., etc. You come up with a formula. You have a control group, an experimental group, and you see if it's true. That's a strict hypothesis test. And with a strict hypothesis test, you have new data. So that's the crowning peak of your primary source information. And then above that is where people go in and they compare the different studies. And they look at them, compare and contrast, and draw conclusions. And those conclusions are what the practitioners use. Because in an evidence-based practice, what methods do you use? You use the methods that have the greatest evidence. Not the ones so much that you personally think are so wonderful. What you personally think is not so important. What's important is what is the evidence. So in the best case, you have a meta-analysis of all of the different research studies. Okay, so that's the filtered information I mentioned here at the bottom. All research that is relevant to a topic is evaluated based on the criteria for confidence of this primary source information. Now, if you don't do a completely comprehensive meta-analysis, you miss some studies, or there's some details in the studies you didn't go through. Well, that's still a meta-analysis. You just have to make clear the limitations of it and what was not considered and what was not complete. So sometimes we don't have the time, resources to do something perfectly well or as well as it could be done, but there's still some progress and someone else can take that work and then complete it. So that's the evidence-based astrology pyramid. So what does this pyramid do for us? Number one, It allows us to assign an estimated confidence level to a different idea. How sure are we that Aries is pioneering, da-da-da-da? Well, actually, we have very little confidence in that. Research has been done of the qualitative model fitting level, right up here. It's been done. And it very strongly indicates that Aries is not aggressive. So these are the kinds of things that we can do using the pyramid. And because it's higher on the pyramid than your personal experience, we have more confidence in it. And it's a well-conducted study. We follow the pyramid. And it works. It works because this does, in fact, give greater confidence. Number two, using this evidence-based astrology pyramid, it reduces differences of opinion between researchers because it provides clear guidelines, clear roadmap for how to evaluate things. What happens in professions is that the different experts in research methods, experts in the field, will come to similar conclusions. Will they reach identical conclusions about exactly how much confidence? No, because there's going to be some window, some variation. Someone may say, I have 15%. Somebody may say 10, 20, but it's not. You're going to have one researcher say I have 15% confidence and another person say I have 90% confidence. That will not happen. It just doesn't because the guidelines are so clear. That happens now when you do not have an evidence-based astrology pyramid. And right now, 99% of astrological ideas are down here at the lowest level. That's where they are. We haven't even begun this process. So those of us involved in evidence-based astrology, this is what we're doing. We're following this pyramid. And we're conducting research and we're building a system of astrology where the ideas that have the greatest confidence are the ones that are used, and the ones with the lowest confidence are less used. And the ones way down here that have not been studied in with modern research methods, and it's just people's personal opinions and traditional ideas, we have almost no confidence in them. They might be right, but they haven't been studied. So we don't have confidence. We don't use them. We don't take wild shots in the dark and say, well, I don't know, we don't have any research, but it works for me. No, that's not the idea of an evidence-based practice. It's not, well, what, it works for me. It's a matter of have the ideas been evaluated and tested, properly assessed and evaluated to see what the confidence level is. Number three, this evidence-based astrology pyramid focuses attention on the research results rather than the subjective impressions of the astrologers. That's what I was just talking about. Whether an idea is endorsed and used in practice is a matter of where that idea is in relationship to this pyramid. Have these studies up here been done? Were they done well? Were the results? How strong were the results? All needs to be taken into consideration. And number four, as I mentioned earlier, towards the beginning of this presentation, the guidelines have to be enforced to prevent research from indicating exaggerated confidence level. They have to be enforced. In the field of medicine, there are there are some articles published in peer-reviewed journals on violations of the regulations. So that's not good. They have to be enforced. Obviously, if they're not enforced, just having them on a piece of paper does not do any good. So, conclusions, three conclusions. An evidence-based astrology pyramid provides an essential tool for evidence-based astrology, or what we also call cosmic cybernetics. We also call it cosmobiology. So this is one of the tools that's needed in an evidence-based practice, to have your evidence-based pyramid. So here's a proposal for one. It's a starting point. It can be refined and improved, but it's much better than nothing, and it's going to help guide things in a reasonably good way. Number two, as I just said, this is a first proposal. It can be improved over time. Number three, this evidence-based astrology pyramid will appear soon in the complete research guidelines at the Cosmobiology Institute website, cosmobiology.org. So Again, here in the research section at cosmobiology.org, here are the short guidelines, which you can go to right now and get some details on these different research methods. And within a few weeks, we will be uploading the complete guidelines, which go into detail on the different research methods, what the strengths and weaknesses of them are, things to, to be aware of, to make sure the research is done in the best possible way. Okay, so we are building a new discipline, evidence-based astrology. Never existed before. We didn't even have a knowledge pyramid. Now we have one. We didn't have guidelines. We have all these things are being put into place. We now have a nonprofit institute dedicated to helping anyone who wants to contribute to this research, to work with each other, to share our expertise and our resources to move this forward. So the Cosmobiology Institute is here for you, to help you with whatever interest you might have in evidence-based astrology. Some people prefer to call it cosmic cybernetics. Some people prefer to call it cosmobiology because it is a modern evidence-based approach, which is radically different from over 99% of astrology. Nearly all astrology is not part of the modern movement of evidence-based practices. So thank you very much for listening, my friends. If you're a subscriber, thank you very, very much. If you're not, if you could click on subscribe, it really helps. There's also a membership. You can meet with me once or twice a month in a live Zoom meeting for questions and answers. There's information here on how to join. There's 3 different ways to join that membership. Again, thank you very, very much. God bless. Namaste.